Welcome. I'm Melissa Price Crom, Executive Director of the North Carolina For the People Action, formerly Voters for Clean Elections. We are the pro-democracy coalition here in North Carolina, and we're here to address a very dangerous anti-democracy bill, House Bill 237. Put simply, House Bill 237 hurts North Carolinians, and it hurts our democracy. It takes the power away from what most North Carolinians want to talk about and gives that power to wealthy special interests by curbing the right to protest, outlawing the healthy use of masks, but permitting the super rich to mask the dangerous flow of big money in state politics. Now, the right to protest is one of our country's founding principles, enshrined in the First Amendment. Protest founded this country. Protest has paved the way for ending segregation, bringing troops home from war, and universal suffrage for women and equal rights for every American and more. Protest holds elected officials accountable and uplifts the voices of the most marginalized communities in our country and are an effective way to move our country forward. Now, opening the floodgates to more mysterious big money in politics does the opposite. It breeds corruption. Now, today, you're going to hear from individuals and partners on this political money laundering scheme, attacks on the right to protest, impacts on our marginalized communities, and the harms to individuals of our community on the health issues. Thank you.
Hi, I'm Ann Webb, and I'm here on behalf of Common Cause North Carolina's thousands of members across the state. We know that HB 237 makes it harder for people who need to wear masks to stay healthy and more dangerous for protesters to exercise their rights. But I'm here to talk about how HB 237 also makes it much easier for wealthy mega donors to mask their identities when pouring money into political campaigns in our state. Powerful politicians are rewriting the law to let ultra-wealthy donors send unlimited cash to state fundraising committees by first funneling the money through federal fundraising groups. In turn, the federal fundraising groups could pass all that secretive money directly to candidates. On top of that, the identities of these deep-pocketed donors would be buried from public scrutiny, robbing the people of our right to know who is trying to manipulate our elections. Some politicians are saying that this secretive self-dealing policy simply levels the playing field between Democrats and Republicans. Well, we're calling a foul because neither party should be hiding money and allowing mega donors to pay to play. With the power of the majority comes the responsibility to use that power to strengthen our state's democracy, not sell it off to a few rich donors to maintain a grip on that power. Let me repeat, this applies regardless of which party is in control. Taking away state oversight and limits on political contributions is not in the best interest of the working people of North Carolina. We, the people, deserve clean elections free from the undue influence of wealthy individuals and corporations. Thank you.
Good morning. I'm Cheryl Carter with Democracy North Carolina. While North Carolinians navigate the fifth year of an ongoing pandemic, high gas prices, increased food costs, and more, the so-called leaders in this building are targeting vulnerable mask wearers like me. And the most American thing in our country, as Melissa referenced, the right to protest. Everything's blown away. Sorry, y'all. Thank you. House Bill 237 is their third attempt to attack nonviolent protest and criminalize protesters, following HB 805 in 2021 and HB 40 in 2023. When will these lawmakers focus on our needs and priorities and do their jobs and stop wasting taxpayer dollars? There are so many disturbing aspects of this bill, But I'm going to focus on one that's very personal to me, and that's attacks on bodily autonomy and my health. I have asthma and generally get multiple upper respiratory infections on a yearly basis. I also suffer from chronic bronchitis. Because of my history, I worked so hard in 2020 to avoid COVID. And as soon as vaccines were available, I made sure to get one. But in 2021, when the trusted guidance said it was safe for us to be outside unmasked, I joined my daughter at a concert, and we both ended up with COVID in less than a week. My first week, it was like a really bad flu. I had a lot of high temperatures, but that second week, it went straight to my lungs, and I had to take a myriad of prescription medications. And I can tell you, I was miserable. It took me more than 7 months to recover. And because of that, I also have times where I continue to deal with brain fog, and I just go blank. That's such a triggering feeling because my late mother died from dementia, and my aunt is currently suffering with dementia. For that reason, I mask everywhere, whether I'm at the store, whether I'm at work, out here with you. You're always going to see me with a mask. And I continue to manage my risk tolerance daily. Thankfully, I haven't had those annual infections like I told you about, and I am so thrilled about that. Even if COVID weren't still persisting and alive, I would still mask. At the moment, our elected officials have chosen the economy and profits for the wealthy over the people. The data has been intentionally hidden while the pandemic continues on. I shouldn't feel like an outcast or be shunned, as I've been time and again in choosing to protect myself. This bill only further perpetuates this stigma and subjugates me. With this bill, my mask makes me an immediate suspect. A law enforcement officer or anyone in public or private can demand that I remove it temporarily for identification purposes. Police officers will be tasked with making judgment calls, as well as any Joe or Karen being authorized to demand removal. Do they understand how scary that is for me as a Black Indigenous woman? This sets an extremely dangerous precedent. Any amount of time without a mask puts me at risk. Reinfections put us all at risk, as seen by an increase in heart disease, cancer diagnosis, and cognitive decline across the board. And have you heard of any bills dealing with long COVID? Nah, me neither. Yet, as of March, nearly 7% of Americans, that's 17.6 million, are grappling with its effects. 1 in 5 Americans, and others continue to die of the disease every day. This issue has become so politicized and just shouldn't be. This is about ableism, bodily autonomy, and how we choose to protect ourselves. If gun owners can conceal carry and stand their ground when they feel their life is threatened, why is it any different for me and others who are making decisions for our health and lives? I deserve to live in peace and to protect my health. The lawmakers who were once committed to protecting personal freedoms are now the same people who want to take mine and yours away. Let's not let them. Thank you.
Thank you. Very good.
Hi, my name is Ginny Dudek, and I am an RN MPH. I am active in a Get Connected group of people across North Carolina who have immune deficiencies or family members who are affected. As a person with common variable immune deficiency, I am speaking for myself and my friends to express urgency and the need to protect our health. My body doesn't make antibodies to fight infection, and for this reason, I wore a mask long before COVID to try to reduce infection and injury to my lungs. This is a lifelong condition with no cure in sight. I do benefit from infusions of immune globulins twice a week, injecting myself with 8 needles to deliver liquid gold from plasma donors to provide me with antibodies that I cannot make myself. This treatment helps to reduce the number of infections that I get, as does wearing a mask. I was confident when HB 237 was sent back to the Senate that they would consider the people of needs like me. But the proposed anti-masking law went from bad to worse. This legislation would make it illegal for me to wear my mask for my safety. As written, a mask must only be worn for the purpose of preventing the spread of contagious disease. This bill added language that gives anyone who is in the same space as me, whether it is a public or private location, the right to request that I remove my mask to show my face. The likelihood of someone asking a gray-haired boomer like me, who for the most part lives in a bubble, to remove my mask is unlikely. However, people of all ages and races have immune deficiencies and need the right to wear a mask to protect them from contacting contagious respiratory infections. Thank you.
Thank you. Thank you for joining us here today. My name is Shruti Parikh, and I am the head of Education and Political Engagement at North Carolina Asian Americans Together and NCAT in Action. Let's be clear. House Bill 237 is a blatant attempt to retaliate against protesters who are exercising their right to protest at the expense of historically marginalized communities. All of us have a right to privacy, especially protesters targeted with threats and violence for simply exercising their right to free speech. The timing of this bill is no coincidence. It's a clear retaliation against protesters on our college campuses who spoke out against the genocide in Gaza. The Asian American community is rooted in protest, and we will continue to speak up against the attempts to silence our First Amendment rights. In addition to the clear violations of our right to protest, this bill sets a dangerous precedent that will have lasting, harmful effects on members of our community, as well as Black and Brown communities. Anyone that wears coverings for religious and cultural reasons. There are exceptions for medical grade masks. Though there are exceptions for medical grade masks, many members of our Asian American community rely on masks that do not fit under the specifications of this bill to keep them safe. As a result, our communities will be subject to unnecessary policing and profiling, all due to this political ploy to silence the voices of our protesters. I also want to address the surprising addition of new campaign finance laws to HB 237 that allow for increased anonymous campaign donations. Including this as a late addition to an already egregious bill is a deceptive attempt to subvert democracy at the cost of North Carolina voters. This tactic is something that we've seen before in attempts to pass legislation behind the backs of voters, even in scenarios as unbelievable as the addition of abortion restrictions to a motorcycle safety bill. This new policy only serves to dilute the power of the voter by allowing unnamed money and influence from outside of our state. By hiding this campaign finance policy behind the already concerning mask bill, GOP lawmakers have made it clear that their goal is to subvert the voices of the people and instead open up our elections to more nameless, outside money behind the backs of their constituents. Thank you again to all community members, allies, and advocates for being here today in solidarity. We urge all of our representatives to put our safety and rights ahead of their pockets by voting against this harmful and discriminatory bill.
Good morning. I'm Mario Alfaro, Policy Manager of El Pueblo. 4 years ago, COVID-19 revealed inequity in terms of access to health services, particularly in communities of color. The pandemic showed that the use of a mask is essential to prevent the spread of viruses. And yet, since 2020, the North Carolina Department of Health and Human Services has recorded more than 3.5 million infections. Today, it is necessary to remember that more than 20,000 people died in our state due to COVID-19. The pandemic hit us without mercy, but it seems that our legislators did not learn the lesson. HB 237 threatens respiratory disease prevention efforts. The use of a mask is the most basic way to avoid infections, that is, to protect ourselves. Like most of you, the last global health crisis taught me to take care of myself and my family in a committed and responsible way. Little by little, we became aware of the importance of following the recommendations of public health experts, and we are concerned about knowing and applying good practices to prevent the spread of diseases. The role of community health workers in the fight against COVID-19 was essential, and they only had two tools to protect themselves: mask and hand sanitizer. El Pueblo, through our adult leaders of the Community Leadership and Action Committee, continues to provide masks because we are aware of their importance. We oppose HB 237, among other reasons, because it violates the fundamental right of any person to take care of their health and weakens collective prevention efforts. HB 237 is not about public safety. This proposal violates the right we have to participate in public demonstrations and, at the same time, to protect ourselves. We are not mobs or criminals. Do not confuse us. Stop playing with the health and lives of those of us who live in North Carolina. Buenos días, soy Mario Alfaro, gerente de política de la organización El Pueblo. 4 años atrás, COVID-19 reveló la inequidad en términos de acceso a servicios de salud, particularmente en las comunidades de color. La pandemia demostró que el uso de la mascarilla es esencial para evitar la propagación de virus. Y sin embargo, desde el año 2020, el Departamento de Salud y Servicios Humanos de Carolina del Norte ha registrado más de 3,5 millones de contagios. Hoy es necesario recordar que más de 29,000 personas murieron en nuestro estado a causa del COVID-19. La pandemia nos golpeó sin piedad, pero parece que nuestros legisladores no aprendieron la lección. La propuesta HB 237 amenaza los esfuerzos de prevención de enfermedades respiratorias. El uso de la mascarilla es la forma más básica de evitar contagios, es decir, de protegernos. Al igual que la gran mayoría de ustedes, la última crisis sanitaria global me enseñó a cuidarme y a cuidar a mi familia de forma comprometida y responsable. Poco a poco tomamos conciencia sobre la importancia de atender las recomendaciones de los expertos en salud pública y nos preocupamos por conocer y aplicar buenas prácticas para prevenir el contagio o la propagación de enfermedades. El papel de los trabajadores comunitarios de la salud en la lucha contra el COVID-19 fue primordial y solo contaban con 2 herramientas para protegerse: mascarillas y gel desinfectante. El pueblo, mediante nuestras líderes adultas del Comité de Liderazgo y Acción Comunitaria, siguen proporcionando mascarillas porque somos conscientes de su importancia. Nos oponemos al expediente HB 237, entre otras razones, porque violenta el derecho fundamental de cualquier persona a cuidar de su salud y debilita los esfuerzos colectivos de prevención. La HB 237 no se trata de seguridad pública. Esta propuesta vulnera el derecho que tenemos de participar en manifestaciones públicas y al mismo tiempo de protegernos. No somos turbas ni criminales, no nos confundan. Dejen de jugar con la salud y la vida de quienes vivimos en Carolina del Norte. Gracias. Thank you.
Hello, my name is Thessa Pickett, and I'm with the NAACP State Conference. And I stand here today with our partner organizations and agencies. The HB 237 is yet again another anti-protest bill, and it is an unnecessary and excessive measure that will suppress the freedom of speech and further criminalize Black and brown communities. It is retaliatory and rooted in a false narrative that protests are dangerous towards political expression, disfavored by its proponents. If enacted, HB 237 would have a chilling effect on our constitutionally protected speech and assembly, and we urge you to oppose this legislation. When protesting or when protesters block traffic, they participate in the long American tradition of freedom of speech and civil disobedience. We now celebrate the stories of the powerful racial justice protest of the 1960s, like when Dr. King led the iconic 1965 march that blocked traffic and occupied the full width of the bridge in Selma, Alabama, or when protesters refused to give up their seats on buses, trains, and lunch counters. Civil disobedience has always been part of the country's political traditions. What's new is the effort to impose harsher penalties on protesters. If we accept these anti-protest bills now, we are accepting the weakening of our democracy and the lessening of our freedoms and powers. Thank you.
Good morning. My name is Attorney Dawn Blagrove. I'm the Executive Director of Emancipate NC. And I stand here with so many of my colleagues to say enough is enough. We need for the people to remember that democracy belongs to the people. Democracy belongs to the people. Our General Assembly seems to have forgotten that. This piece of legislation, HB 237, is a perfect example of not only the dysfunction of our General Assembly, but the intentions of a very few white men to determine for the rest of us what is normal, what is constitutional, what is right, what is fair. We have a constitutional right to protest. However, our General Assembly and a few men here have decided that we should no longer be able to protest if we are not protesting for the things that uphold and support white supremacy. That is an infringement on everyone's democracy. The same group of men has also decided that you should not have the autonomy to decide whether or not you wear a mask to protect yourself, to protect and control your own health. Once again, this is an infringement on democracy, on your democracy, on the power of the people. And then, in an ironic twist of fate, and an absolute nod to the unflinching and unwavering desire of this General Assembly to uphold white supremacy and white supremacist systems, they put into this bill, with no oversight, with no input from the community, a measure that would make it easier for folks to hide their faces when they are donating and participating in the financial support of our political elections. Make no mistake, folks. They give these bills lofty titles, make them sound like they are about protecting community, make them sound like they are protecting you, the people, from something scary. The only thing scary in the building behind me are the men who think they have unchecked power. The only thing frightening is the fact that these people think you, the people who have the power, you, the people who are democracy, who embody democracy, should not have the right to express it and use it however you see fit. More importantly, and much more duplicitously, they also want to take away from you the power to be able to pick who your elected officials are, the power to be able to determine who you give power to, be it through gerrymandering or campaign finance rigging. They are taking away democracy. We stand here today to say no, and that we will have no more. It is imperative on the people that we are able to exercise our right to peacefully protest. It is imperative on the people that we exercise our right not to peacefully protest. Protesting is a part of democracy. To chill the right to protest is a surefire sign that you are afraid of the people. And when you are afraid of the people, you are afraid of their power. And when you are afraid of the power of the people, you are afraid of democracy. So we stand here to say no more. And we need you, the people, to stand with us in the protection of democracy against those folks who claim to love it, but do everything in their power to destroy and degrade it. We'll take questions. Oh, I'm sorry, we will not take questions. We have another speaker.
Good morning. My name is Javita Lee, and I'm the Policy Director for Advance North Carolina and the convener of the North Carolina Black and Brown Policy Network. And today, I am standing here completely exhausted. Exhausted by the fact that time and again, our legislature is spending more time creating ways to further penalize our Black and Brown communities by creating unnecessary legislation to directly harm them and their well-being, rather than prioritizing legislation that could actually improve the current conditions of their lived experiences. I'm exhausted by the fact that, yet again, we're here and we're seeing a repeat of the same type of legislation with HB 237 that we've seen before with HB 40 and any other anti-protest legislation that's been presented here in this state. The bottom line is simple. They don't want to hear us. It is our First Amendment right to free speech and protest, but it seems to me that there are people within the four walls of this building behind me that believe that that fundamental right only belongs to a select few. But the thing about that is the very freedoms that folks that look like me are able to experience have been a direct result of protest. My ability to be considered more than 3/5 a person is rooted in the power of protest. My ability to enter a city bus and stand or be able to sit behind the driver rather than in the back is at a direct result of the power of protest. My ability to cast a ballot and not have to pay a poll tax or complete a literacy test is rooted in the power of protest. My ability to walk into a restaurant or a store and utilize the front entrance is rooted in the power of protest. My very being as a Black woman in this current state, in this country at this time, is rooted in the power of protest. And it's a power that they are trying to eliminate. But we will not stand by silently. Advance Carolina, as well as the other organizations represented behind me, will firmly and wholeheartedly stand against HB 237. And we will do all that we can to protect the folks of North Carolina against its impending impact. Thank you so much. And now we will take questions.
Do we have Laura?
For the very reason that I spoke of earlier, it's at the discretion of law enforcement to determine if a mask is medical grade. Would you say my mask is medical grade or not? Exactly. How do you know? How do they know? So why are we giving that power and asking law enforcement officers to yet do one more thing in their job? Why are we saying that a manager in Walmart can look at me and say, I don't recognize you, I feel threatened, I need you to drop your mask? So if people don't know, why are they making this a law and putting my life at risk?
Further questions? All right, some of us will stay behind if you have any more questions on this. Thank you.